Good day, everyone. Now we will be talking about the musculoskeletal system, which will be divided into the skeletal and the muscular system. The skeletal system will be the only one that's part of the prelim, while the muscular system will be a part of the midterms. There are two divisions of the skeletal system, the axial skeleton, which comprises 80 bones, and the appendicular skeleton, which comprises 126 bones. So in an adult, 126 plus 80, that comprises of 206 bones in total. The axial skeleton is further subdivided into the skeleton is further subdivided into the skull, the hyoid, the auditory ossicles, the vertebral bones, and the bony thorax, as well as the appendicular, the pectoral, the upper limbs, the pelvic, and the lower limbs. Your axial skeleton and your appendicular skeleton. The appendicular skeleton in red are usually the bones of the appendages. That's why they are called appendicular. The axial skeleton, we have the skull. There are 8 cranial bones and there are 14 facial bones. You have here your frontal bone, the parietal bone, the sphenoid, which is found inside, the lacrimal bone, the zygomatic bone, the prominences here. You have your mandible, the lower part of the jaw, the maxilla, the upper part of the jaw, the vomer, the nasal bone, the vomer, which is a part of the nasal bone, and there is a separate nasal bone, and the temporal bone, which is found in the temple, or when you do your headache sign, like when you post, you have an headache, that's where you hold your hands, that's your temporal bone. In studying the skeletal system, we will not deal with more of the physiology because that will be discussed in the lecture. We are more after of memorizing the parts. That is why here you can see that there are colors. They are colored. And I'm also asking you to color because that would help you in the memorization. There is no other way of teaching this one rather than by, of course, showing it to you and identifying and helping you identify what structures are intended to be identified, of course. The skull in posterior view, we have here the occipital bone, the one that rests in the base of your skull. And we have sutures. The sutures here are lines of fusion. They are not fused, meaning wala pa sila katapikanay in infancy, and gradually they are completely closed or they completely fused 10 months after that. So these are the sutures. You have here your sagittal suture, and then we have here your you have here your posterior suture. Next, you have the palatine bones. You have your perpendicular portion of the palatine bone and the horizontal portion of your palatine bone. Your perpendicular portion lies perpendicular to the axis, and of course, the horizontal portion lies horizontal to the axis. You have the hyoid bone, which is here, found here. Your hyoid bone serves as a suspension for the laryngeal bone and the hyoid cartilage. The hyoid cartilage is the one that produces the Adam's apple for males. And the hyoid bone is further divided into its smaller parts, the tubercle, the upper surface, the median border, the lateral border because it is closer to the midline, and this one is farther from the midline. You have the body. You have the lesser cornu here, one, and we have another lesser cornu, two here. You have the transverse ridge, the median ridge because it's found in the middle, and the transverse ridge is found on the transverse sides, and then you have your greater cornu here. Okay, so if I ask you what is the medial border of your of the hyoid bone, your answer would be the greater cornu. If I ask you what is the lateral border of the hyoid bone, it is this part here, which is not actually it is not defined on what part this one is. So your greater cornu, take note, is the medial border of the hyoid bone. Next, we have the vertebral column, which is comprised of 26 bones, 7 cervical bones, 12 thoracic, and 5 lumbar. For you to familiarize or for you to memorize this one is that you eat breakfast at 7, the top bones or the cervical. You eat lunch at 12, the lumbar. And you eat dinner. Sorry. It's the thoracic. The thoracic. You eat lunch at 12, thoracic, and 5 lumbar bones because you eat dinner at 5. You eat breakfast at 7, you eat lunch at 12, and you eat dinner at 5. The cervical bone serves as, or your spinal bone serves as protection for the spine, as the spine transverses here in the vertebral foramen. This is where your spine inserts. There are also the transverse foramina or the transverse foramen, which also is traversed by the spinal cord. Your spine here inserts in the vertebral foramen and also in your transverse foramen. These are the different parts of the spine. I will not be asking this in the practical examination. The different parts, I will not ask them. So here you have the costal facet, then you have your spinous process. Amo na sila ang mga gabulto sa likod. So you have your lumbar vertebra, which has your lumbar body, the vertebral body, the lamina, the spinous process, the pedicle, and the transverse process. Here we have the sacrum, which is actually 5 bones that are fused all together. So that's 1, 2, 3, 4, and 5. These are 5 bones that are fused all together. Next, you have your bony thorax, which is comprised of 12 bones. It is first comprised of the 12 ribs. You have the clavicle or your collarbone. You have the sternum, which is its superior border is the manubrium. Its medial border is the body of the sternum, and this part here, the inferior border, is the xiphoid process. You have we have 7 true ribs. We have 1, 2, 3 false ribs, and we have 2 floating ribs. True ribs because they are connected separately to the sternum by their own ligament. The false ribs are connected, fused to one connection to the sternum. Wala sila individual connections. And your floating ribs, your 11th and 12th rib, are actually not connected to the sternum. Ara lang na sila ga-float. That is why they're called your floating ribs. You have the pectoral girdle, which comprises of 4 bones, and your scapula, found at the back, your wing bones, are composed of 2 bones, the left and the right. Next, you have the upper limbs, the appendicular skeleton, which is comprised of 60 bones. We have the humerus too. because that's also left and right. The one that is found in the arm, that is the humerus. It has a head. It has the shaft or the body. And we have here the trochlea. The trochlea serves as the attachment, the point of attachment for your radius and your ulna. The radius and the ulna are found in your they are found distal. They are found distally. So you have here your radius and your ulna. The radius is the one connected to the thumb, and the ulna is the one connected to the pinky finger. We have 16 carpal bones. We have the distal phalanges, the intermediate phalanges, and the proximal phalanges. We have the metacarpals, and then we have the carpal bones. I want you to you have to memorize your carpal bones. You have your lunate, the pisiform, the triquetral, the hamate, the capitate, the trapezoid, the trapezium, and the scaphoid. So that's 1, 2, 3, 4, 5, 6, 7, 8. You have 8 carpal bones. Carpal bones are the bones of the wrist. Okay? Your distal phalanges are distal because they are the farthest of your phalangeal bones. The intermediate phalanges are the ones that are found in between. And the proximal phalanges are the ones that are close to your metacarpals or the palm bones. Your thumb has no intermediate phalanges, or it does not have an intermediate phalanx. Because your thumb is too short, it is short, that it does not have an intermediate phalanx. It only has a distal and a proximal phalanx. So you have your metacarpal bones, the palm bones, and you have your phalangeal bones. Again, this is the proximal phalanx, the intermediate or the middle phalanx, and then we have the distal phalanx. The pelvic girdle or the pelvis is comprised of 2 bones, one on the left, of course, and one on the right, as separated by a median line. So we have here the ilium, the greater pelvic bone, and we have the ischium, wherein this is the lesser pelvic bone. Lesser pelvic bone. The iliac fossa is a depression in the ilium. You have your iliac crest here. That's the iliac crest. Next, you have femur, which is the longest bone in the body. You have 2 femurs, one on the left and one on the right. This is it is related, or it looks like the humerus of the arm. But in the in the case of the legs, you have the femur. Then we have the tibia and the fibula, having the tibia the bigger bone and the fibula being the smaller bone. Next, the patella. The patella is actually movable. Amo na siyang sa inyo, that's the kneecap. It is movable because of the presence of synovial fluid, which gives lubrication here. It gives lubrication to your knees as to hindi sila mag-grind to each other. And the patella serves as the covering. It serves as the covering as well as the anchoring to your femur and your tibia. Your tibia and your femur are not grinding each other because of the presence of the synovial fluid. Then you have your tarsal bones. Here you have the tarsal bones, which corresponds to the carpal bones. Here you have your metatarsal that corresponds to your metacarpals. Then, of course, you have your proximal tarsal, your intermediate tarsal, and your distal tarsal, or your phalanx man gyapon, because phalanx are fingers in translation. So, you have your distal phalanx, the proximal phalanx, the medial phalanx, and the distal phalanx. So that ends the discussion for the skeletal system. Please do your activity for this one so that it will help you in memorization of the different bones in the body.